Hello and welcome. Thank you for coming. My name is Tina Grinolds. I'm a registered nurse with the Bon Secours Medical Group, and I have asked you here today to talk about the policy for nursing continuing education. And I again appreciate you coming. The reason this is important is because the Bon Secours Medical Home Group currently does not have a policy for their nurses to receive continuing education. Yet continuing education is important, and we all know that. Our providers have a policy for continuing education. The nurses inpatient have a policy for continuing education, but the nurses outpatient do not. And the problem with that is we saw last month during the Nurses Week celebration that we heard feedback from many of the LPNs in the outpatient setting that they were not allowed to go to any of the festivities because they were not provided training. Their managers did not pay for it. So we're asking you to make it a blanket policy that all the nurses in the medical home group get continuing education paid for. We realize that there's a financial need, so there'll probably be a limit, and that's fine. There's a limit on the physicians as well. We're just asking that you make it uniform across the Bon Secours Medical Home. And I also wanted to point out that last month during Nurses Week, we also brought to light the fact that nurses were voted again for the 14th year in a row that we are one of the top 10 most trusted professions. And I think a great way to keep it that way is the continuing education so that we look professional, we act professional, and we are staying on target with all the changes with technology and everything else going on in our world today. So that's why we have asked input from the Finance Committee and the Education Committee and managers, the Assistant Director, the Chief Nursing Officer's Office, and all of the rest of you here. We thank you for coming and listening, and we ask that you keep an open mind as we discuss today the importance of doing this. Now, like I mentioned, finances is always an issue with everything, but we're changing our payment method now. We're no longer being paid for the numbers of people we run through the office every day. We're being paid for quality. And part of that quality is going to require the Finance Committee, require our offices committing themselves to the financial obligation. I know you're going to see a return on the investment. I know you're going to see a positive change with the continuing educations that the nurses get. And some of the things that we would like to mention is that we're running into the 6-year mark for the Bon Secours Medical Group. So this is the perfect opportunity for us to institute the education and start training on the culture we want presented to the community, the values, and to start training our staff to meet the needs coming down the pike in the future. We know technology is an issue. We know the electronic medical record is part of the things that we need to use in order to meet the quality gaps. And our patients have questions that the nurses currently aren't trained to answer. So that would be awesome to institute this so that we can do it. As far as ways to meet the education goals, we have a Bon Secours nursing school attached to us, and they already do training for nurses because they're a nursing school. So there must be a way. They've helped us in the past get CEUs for different training outpatient wise. There's got to be a way we can work with them to do CEUs at a low cost, maybe even make them webinars so that everybody can eventually tap in, as well as giving some of the offices time to be able to go out and meet together, work together, collaborate, build those bonds that you need so that we can all reach out to each other and work together as a team. The multidiscipline team is important outpatient, just like it is inpatient. Outpatient, it looks different. Outpatient, it's the primary care offices, it's the specialty offices, it's oncology, it's cardiology, it's the skilled nursing facilities, it's the nursing homes, it's the assisted living homes, and it's the rehab. It's social workers, it's the churches, the families, and your neighbor who we have to talk to in order to help get our patients' needs met. So that requires a different skill set, and it would be great to include that in the education. The end of the fiscal year is coming up in the end of August, so now's a great time to look at all this, iron it out, hash out the numbers, and get it in place so that starting next year we can start sending out the notice to everybody that we are approving continuing education for the nurses. There are also education needs for the nurses. Like I mentioned, with technology, we've come out with a 24/7 office visit. The nurses want to know, how do I document with that? The electronic medical record, we're still not documenting completely in there that we're hitting all of our dashboard marks for Medicare and everybody else. That's a great opportunity for education. Immunizations, who pays for it? How do we chart it? What do we do with it? And many other things can be done in order to help with education. And of course, this is the perfect time, like I said, to build the culture. We can focus on our core values of communication and integrity. We can get rid of the old mindset that bullying and passive aggressiveness is okay in the healthcare setting, because it's not. We can start a whole new culture and have us all moving in the same direction on the same team at the same time. I think that would be amazing. Our mission is good help to those in need, and we're doing that in the outpatient setting, but the training would really help. So we're asking that you do this. This would be a great way for the nursing leadership to show the nurses that they really are important, just as important in the outpatient setting as they are in the inpatient setting. Do you have any questions? Okay, I have a question here about communicating the policy. How would you communicate that the policy is enacted? Great question. We can communicate it the usual ways. We email newsletters. There's through email, of course, staff meetings, and the daily huddles that each of the offices do. The education committee has ways that they communicate what's offered. They could also initiate the communication through that and also get feedback from the staff. Any other questions? Culture change. Great question. Why does the culture need to change? So the culture needs to change because healthcare is changing. So we all need to be schooled in the better communication, the finesse of working with different departments and different individuals that are under the Bon Secours umbrella. So they have different policies. They might have a different way of looking at things. We all need to learn to work together for collaboration of care so that we can meet the quality needs that our patients deserve and we all want to give. Any other questions? Thank you very much for coming, and I look forward to hearing from you again soon. Thank you.